All right, so when we're doing wireman's not as difficult as he looks. We're going to do anatomical position. So if you're looking at me, this is anatomical position. All right, palms forward, feet facing forward, standing erect. So again, if you memorize the pathway of the blood vessels, then it makes it a lot easier to know what's going on with wireman. Now, I will say this. What's this over here? Anybody answer that? Neither do I. I don't know it either, because these tiny little guys, they're just some branches, right, from different arteries and veins, and it gets a little hairy when we got stuff going on down there. So we're going to use wireman for major arteries and veins, and we can see some nice branching or it going specifically to organs, okay? So let's start up at the top here. If you can see this one here, okay, this is going to be and we're going to pay attention to left and right. This is going to be right side, this is going to be left side, so when you're looking, you got to flip it if we're looking at the front, okay? This is going to be the left external jugular vein. This is right here, this guy is the left internal jugular vein. And as I've said before, the internal jugular is going to be thicker. And of course, we have them on the right side as well. We're going to just kind of snip it here and then not pay attention to above that. So the artery that we see here, these are going to be the common carotid arteries. So this one right here specifically is the right common carotid artery. So again, the pathway is pretty clear if we stay away from some of the massively branching, arteries and veins. And so if we come around here, we have subclavians, okay? Now, here's another thing. How do we know left and right? Well, on wireman, first off, the heart's in the front, liver is always on the right side, spleen is always on the left. So orient yourself. As soon as you see a picture of wireman, be like, okay, am I looking at the front or the back? Because then we have to establish which is the left and right, because that's going to be very important, all right? All right. Now, we know that right around here-ish is the axillary, but I don't have a bony structure to tell me exactly where I'm at. So axillary is not something we would test. But if I go here, whether it be the blue or the red, it's going to be subclavian vein or artery, okay? The red, of course, the artery, and the blue, the vein, because we're in the systemic circuit. If I want brachial artery, I'll go down here. Well, I'm down far enough where I've got to be, it's before the branching point. It's got to be after where the head of the humerus is. I said that the axillary is around there. We don't have that, but we know we're well past it at this point. So this is going to be left, what? Left brachial artery, okay? Now, if I'm anatomical position, thumb side is radius, pinky side is ulna. This is thumb side. So this is going to be what? Left radial artery, left ulnar artery. Not as hard as it looks if we follow that pathway, right? We go down this side. We said that, now we used the left arm in our other example, but we said that just everything on here is going to happen to be right. We said that if we put it in anatomical position, we raise the arm up, okay? Going and facing the ceiling, coming all the way down is what? That's going to be the right cephalic vein. In the basement down here is going to be the right basilic vein. And in the middle, we have the right brachial vein. Now, it does split into radial and ulnar, but I feel like it gets a little too messy down here, so we're not going to really do that one. Okay? On wireman, at least. Of course, you have to know all of your other structures. Superior vena cava, pretty easy to see, and even the branches. Remember, the first branches off of the vena cava are going to be your left and your right brachiocephalic veins. Okay? So, how about down here? If I point, let me get a pointer. So, if I point down here, I couldn't grab just one stick, right? And so if I point down here, you've got the abdominal aorta. And one of the things I said, I don't know if you can get up in here. If you look right there, so right in there, we've got these, let's see. Actually, it's right up in there. Can you see that? Now, I'm not going to test this one on this model, but that's a celiac trunk coming out there, okay? And so you see a bunch of branches coming out. It goes to a bunch of digestive organs, okay? And at the celiac trunk is where the abdominal aorta begins. So it's essentially, let's turn it around for a second. It's essentially, as we come past the arch, it's thoracic aorta. But once we pass that point of the celiac trunk, it becomes abdominal aorta. So when I point here, it's abdominal aorta. Now the vena cava is inferior vena cava from the bottom of the heart all the way down to the split. There is no abdominal or thoracic or anything like that. And those are pretty well visible here. How about our branches here? What comes off of the abdominal aorta? Well, this one right here is going to be the left common iliac artery, right common iliac artery, right common iliac vein, Can we see the other one? The other one's kind of tucked behind. Oh, actually, we can see it there. Right common iliac vein. When it branches again, so you can see it branching here for the artery, branching here for the vein, this one is what? This is going to be the left internal iliac vein, right? And then the continuation is the left external iliac vein. Left external iliac artery, left internal iliac artery, because you can see the branch point right there, okay? Now again, those you have to be a little closer to see, but I think they're pretty clear. If we come down the leg, and I go down here. Now, usually when I pass through the bony pelvis, the external iliac artery or vein become what? They become the femoral. I can't see the bony pelvis, but if I'm all the way down here, okay, we know we're before the knee, so if I come all the way down here, I'm left femoral artery, okay? If I go here, I'm right femoral vein. What is the one that runs all the way down the medial aspect of the leg? It's the right great saphenous vein, okay? Now again, we have some splits down here, but I think it gets too messy. That's wireman. So, I mean, if you look at that, the only other thing I want to say is, let's point it this way. If you see the model facing this direction, your left is his left, your right is his right, so now we make sure we label everything correctly. Because if I'm up here pointing to the red, what would you say it is? Now it's left subclavian artery, right? Because you're looking at it, and your left is his left. And so you pay attention to that. I can point up here for thoracic aorta. I can point way down towards the bottom for abdominal aorta. Now, you can see kidneys, you can see spleen. If it goes to the spleen, it's splenic, red is artery, blue is vein. If it goes to the kidneys, it's renal artery or vein. Red is artery, blue is vein. Okay? I think that takes care of wireman. All right? If you have any other questions, let me know.